Hello dear colleagues, how are you? I hope everything is okay. My name is Mynzhylky Berdikhojayev, and together with my colleague Sheikh Khan, anesthesiology nurse Bahit, operating nurse Bahit, and anesthesiology team with Dr. Aslı, and the video support team today, Raman. We are planning to start the case number 2. Patient with unruptured aneurysms on the left ICA and left ACOM territory. Patient has a A1 hypoplastic on the right side with the callosal marginal artery. You can see this. There is no pericallosal. I think the pericallosal is coming from the left side, but this is a washout from the left side. I think the artery is patent. ACA is patent from right side. And this is a Presidential Hospital Almaty, National Hospital in Almaty. And vertebral system is clear. Oh. Таврыста гамма начни. Гамма. Okay, 3D rotational done, and it's hopefully the neck of the aneurysm is should be okay on ACOM. This is right A1, I hope. We'll place balloon from left A1 to left A2 for the ACOM aneurysm, and for the PCOM, it's look like balloon assist coiling is possible. If stenting needed, we can place stent at the second session. Yes, I've done it in this condition. 77. I think it's not so clear. Projection 3 millimeter. 3/4. And PCOM aneurysm, it's also something like 3 millimeter. 3-4 millimeter. Okay, let's see the 3D rotational. And okay, this is position for ACOM. It's something like this. 113, I think, and now we can see the aneurysm on PCOM. It's something like this, 52. Yes, I think first of all we need to deal with the ACOM, and then we can come back for this aneurysm. Okay, let's see the ACOM. ACOM is better seen something like this projection. 64, 24. Yes, it's something like this. Okay, we took a gamma for the coiling and the scepter balloon for the assistance. I think it's possible to place also for the contralateral ACA territory. 115 on left side. Maybe this is more illustrative, and also we can control the ACA. Okay, let's check the vertebral-basilar system. In the case of PCOM aneurysms, it's very important to check the PCA territory. It looks like PCA is in place, and this is a PCA with the PCOM, and it's quite safe to deal with this PCOM aneurysm. Okay. And 45 градус. 45 degree, I think is needed for the gamma coiling microcatheter. Yes, time to time we have a problem with the yes, it's the left side. 117, I think it's 90, 27. 27 is 63. Okay. Hello. Так.
Сексенде 20 істеген, бірақ ақырын тартылып жатыр да неме?
Cheers.
Густой болып кеткеннен кейін бе?
Yeah, Gusta. Okay, there is no problem. Abzal gave 80% of contrast. Then it's Gaman brush. Then it's more concentrated, and deflation time is longer. It's not a problem. Okay, now we can see the projection was chosen by Abzal. Okay. As usually for the scepter, 70 or 60% is better. Then balloon is visible, but it's okay, no problem. During the deflation, the balloon may little bit aspirate from the hole on the tip, some contrast, and it's not a problem. Some saline, and it may mix with the contrast. 45 градусов. I asked Abzal to give 45 degree. It is very important. The balloon preparation is a key point to prevent the possible complications. Okay. Yes, and the guiding in the internal carotid artery, and for the coiling microcatheter we will use one of the wires we will see how it will navigate in intracranial circulation. Бақыт экранды 15 см аяғына қарай тарта салыңыз. Okay, this is a new wire. I don't know the name, but it's quite soft. It's quite soft, huh? It's soft, and I think It looks like it's softer than Avigo and the Portal. But it behaves like Avigo and Portal. Чекай Black'ты дайындап қоясаңыз, бірақ ашпай тұра тұрыңыз. Black обычно. Бересің. Тексте болсын болды. Okay. In Avigo and Portal, it's not possible to give a second curve. That's why it might be problematic. We usually giving the second curve for the 14 wire to do it double curved. With this wire, let's see how it would be. The torque is blue. This is for identification. Okay, let's see. It looks like it's rotating, but it's very important to see how long it will keep the angulation. Let's take a look. Yes, the all products on the table has a certification in Kazakhstan. That's why it's no problem to use it. Okay. And for that reason we need a coil 3 by something. 3 қой да, Абзал? 3/8 комплекс суперсофт надо қойсаңыз, 3/8. Потом, скорее всего, 2/8 бересіз, Optima. Yes, we will start with Optima. 2/8 екен дайындап қойсаңыз. 2/8, 2/6. Okay. This is the last image, huh? Yes, it's the last image. Okay, I will use this screen because it's very useful for me. It will give some comfort, but so many colleagues are a little bit commenting that it's not so comfortable for observation. Okay, the first point with this wire, it's very badly visible. Okay, let's compare with Texas. Comparing with Texas, it's nearly invisible. Okay, it's very good point. Okay, let's zoom it as much as possible. Okay, first of all, we need to navigate with the scepter. Yes, as usual, it's trying to go to the okay, it's a contralateral side. Maybe it's better to go contralateral to control both ACAs. I think the okay. Yes, then it's more secured If we control it like this, yes, it was a success. And for the second wire, usually it's a little bit complicated because there is a shipping mechanism. It's inside the aneurysm. Okay, let's see how can navigate it. It goes around the ACA territory. Okay, now it's okay. Let's go smoothly. It's following the previous wire and it's so-called shipping technique. Okay, let's navigate inside the aneurysm. It's inside the artery. Okay, we need to pull a little bit the microcatheter to allow the wire to do the job. No, it's inside the control inside. Okay. It's going to the same direction. No. Okay. Okay. Let's shape it. Then it's important how long it will keep the shape. It's quite angulated. It's interesting. Yes, we gave a little bit more angulation. Yes, my assistant is Abzal Khairatlo. I think I said Shaykh Ahmed. Shaykh Ahmed was on the first case. Today I have two assistants. One is Shaykh Ahmed and the most endovascular one is Abzal. Shaykh Ahmed is microsurgical colleague. Okay, it's visible. I'm not sure is it visible on the old version of machines, but on this Philips we can see the wire. It's shipping all the time. Yes, now we are inside the aneurysm. Okay. Let's navigate. It looks like it's quite soft. It's softer than Scepter, I think. Chikai Black. Chikai Black, I think, a little bit stiffer. This one is softer. Yes, it's soft. Okay. Let's try to navigate. Yes, let's navigate again, but you can see it's quite soft wire. Yes, it's very soft. Okay. Chikai Black пересолнечный? Yes. Maybe it's for the different type of anatomy, but for this anatomy we need something more stiffer to place the gamma. Gamma is very stiff microcatheter. That's why we need something stiffer, no? Okay. Yes, you can compare its staying, and let's compare this wire. Okay, this is a Chikai, the last 10 centimeter, and this is yes, it's a comparison between Chikai black. Yes, it's quite soft. There is no erection, eh? Okay. Yes, it's technical points, and for some companies they start to say there is no difference between instruments, but there are. It's all the time difference between instruments. And for the healthcare system, some administrative workers may say it's 14 wires and it's 14 wires. Where is the difference? And they're trying to say you try to buy 2 different wires, you should work with one, which is cheaper, huh? Also. The cheaper is better, yeah? For the hospital, yes. For the hospital, for the administration, for money saving, it's better, yes. But you can work 10 hours with the bad wire, and then you can take a complication, and I think for administration is it's again. I think the headway, the gamma is quite stiff. Let's rotate. Let's rotate. Something is possible to rotate. It's more stable, but again, this anatomy. Okay, let's see. Okay. Yes, you can see the difference, huh? There is a difference. Okay, I will inflate the balloon to keep the gamma in place. Sometimes it's not only the remodeling, it's also the support and assistance. It's not all the time about remodeling technique. Okay. Үште 8 бере салыңыз. Үште 8. Үште 8, сосын 2-де 6-ны бересіз. И отделялка серый дайындап қоя саласыз. 2-де 6-ны аша беріңіз. The first coil will be Optima. Optima 2x6. Все, и теперь. И 1,5-да 4 деген дайындап қоя салыңыз. We will see. The neck of the aneurysm, it's not so wide. It's wide, but it's possible to deal without this. If it's possible to deal without the stent, then we can try to do it without the stent. Yes, now it's protruding. It's protruding. It's protruding. Yes, if I will pull my microcatheter a little bit back, then it it's some risk of migration of the microcatheter. Okay. I pulled it a little bit back. Отлично. Отлично. The blood pressure is 89. It's okay. On plane lateral, it's look like coil is outside of the aneurysm. On plane A, it's look like inside. Okay. Now 117. It's look like 63. It's a 27 from 90. Yes, 27. 27 from 90. It would be 63, and cranial 7 will be caudal 7. Yes, it's like in mirror. Huh? It's not the exact position. It's like in the mirror. Yes, and now it's look like we are outside of the aneurysm. Okay, let's replace it. It should be something like this. Yes, now it's start protruding. It's a problem when you take a coil a little bit smaller, then it start protruding to the artery. When you take coil bigger, then it's a risk of rupture. Okay. Let's deflate the balloon, and now we can see how it's behaving. Yeah? Yeah, it's look like coil mass inside the aneurysm, and there is no problem with the artery. Okay, I will inflate again. Yes, I think a couple of coils, and then we can place a stent with some shelving on the level of at the level of aneurysm neck. Okay. Bir жарым 4 ашып қоясыңызшы? Аха, шөгіңіз. Аха. Okay, let's see. Maybe we need to place a coil. The coil number 3, which will be 1.5 by 4. I think we need a little bit push the catheter to keep it in place. It does look like some protrusion, but okay. The one loop, it's look like at the neck part. Yes, it's compressing more and more. Huh? Okay. Berdikhojayev dot persons. The second coil was complex super soft, and coil number 3 is a complex super soft helical. Not complex, helical super soft. All 3 coils from bolt Optima. Yes, the one loop looks like in contralateral ACA territory. Let's see how it will be inside the artery. Maybe we need to stent it. I think it's enough, huh? Abzal, what is your opinion? I hope it's enough. Okay. Now the coiling catheter is nearly outside of the aneurysm. Okay. We'll do more angulation to replace it in the contralateral on ipsilateral ACA. The balloon is on the contralateral side. Maybe we need to compress this loop of the coil, but sometimes it's okay. It's not need to place any additional device. And okay. Okay, let's deflate the balloon. As you noticed, it's a 80% contrast, huh?
Yes,
80% contrast. Yes, for the big balloons, it's not need to do more concentrated. Even with the scepter, it's better to have less concentration of contrast. But with Eclipse, it's possible to use more concentrated. The design of the Eclipse balloon is a little bit different than... Oh, it's ruptured. It's ruptured. There is a subarachnoid hemorrhage. There is a bleeding. Huh? Okay, let's replace the micro. I hope it could be possible to replace it. I did a little bit mistake. I took it a little bit earlier, and it looks like it's ruptured. Okay, let's place it. Possible rupture point. Okay, I need to pull it a little bit. I need to pull balloon a little bit. Squid ne görünür? Abla. Yes, you can see the angiography, and there is a bleeding. Yes, it's extravasation. Yes, bleeding is continued. Tez дайындандыр. Вот степ болады. Сквит бар ма, сквит? Сквит 12 ну қоясыңыз. Yes, we'll prepare squid 12. There is still bleeding. Давлениесін тағы төменірек түсірсін. Давление ниже. Давление 70-ке түсіре салыңыздар. Декса керек жоқ. Жоқ, аз ғой мынау.
Иә, бастатығын қойып кетті.
Тағы да және бір. Қазір шамалы айналсын. Yes, maybe balloon will work, and I'm not sure we need to place additional coil. Maybe we need to place one more coil. 1,5-2 деген спираль бар ма? 1,5-2 бар. Микрофлекс бере салсын. Let's place one more coil. Okay, let's place one coil. Итер. There is quite enough space at the back part of the aneurysm. I'm not sure in which part it was ruptured. I think there is no so much tension, but it looks like it's outside, huh? Okay. Назад. Вперед. It looks like it stopped there. Do we need to inject liquid embolic?
Maybe after the equation.
Okay, let's see. Трек шприц. Берест. Спираль носом. Okay, let's see. Let's see what we can do. Definitely. Okay, let's wait 7 minutes. Now my microcatheter is displaced from the aneurysm sac. Let's look like this. What is coming here? The histogram. Let's look like this, huh? Something like here, huh? Right, 67, 59, 10. Right. Yes, it's look like we 59, 10. Yes, I could not do it. Okay. So, yes, it's I think the bleeding came from the posterior part of the aneurysm. Okay, not the posterior, from anterior part. Our microcatheter is on the arterial wall. It looks like it stopped, huh? The coils is inside the aneurysm. Yes. Okay, it's 3 minutes from the beginning. I think the position of the microcatheter is quite safe. Now it's going to the direction of right ACA. And we don't need to place a stent because of this bleeding. Eh? Yes, it looks like it stopped. We can take out as it was bleeding. Yes, on this image you can see the coil loop is on one of the wall of the left ACA, and now aneurysm is occluded and microcatheter in the ACA. Let's check it again. Usually that loop of the wire, it's not causing the problem, and I think we can finish with this aneurysm. No? There is no active bleeding and the coil is inside the aneurysm. Okay, let's pull the gamma to the A1 segment. Okay, let's leave it like this, and then sometimes the microcatheter may compress the whole. Bleeding stopped. Okay. Okay, so now there is a dilemma. Should we treat the PICOM aneurysm or we need to left it for the second time?
Better to leave.
Better to leave, huh?
Yes, I think we need the stent maybe.
For the PICOM? I'm not so sure. PICOM is quite straightforward case, huh? Okay, if we will treat the PICOM, then we will have some time for observation of this aneurysm. Okay, patient has good PICOM and the P1 segment is present and you can see the washout, and it's possible just coil this aneurysm without protection. And then we have time to control the bleeding. Yeah? I especially left my traxes in the ACA territory. If it's needed, we can re-navigate the balloon to the ACOM territory. Okay. The artery was fragile with the coil, or with the tip of microcatheter it was ruptured. I think the indication for this treatment was clear. If it's ruptured in this condition, it may rupture in any condition. Eh?
Yes.
Okay. Let's see. It's something like this. It's a wide neck and okay, I need to go from this side. Yes, also it's better to protect the PICOM, but it's not so necessary. If it will occlude, there is no problem. P1 is in place. Okay, right, left 38. От Сигас. И продолжим. Yes, in some cases we put the Bakarasura and it's very helpful. Huh? It's helpful. Yes, ACOM territory is safe. It looks like everything is okay. Let's measure the size of the aneurysm. Келесі пациентке келе берсінші. Келесі пациентке келе берсін. Жоқ, под место. Это область 7 мм. Так, 3-8 спираль аша берсінші. Six. Yes, I'm asking for the next coil 3/8. İşte 6 biri ver. Ha, biri sal. Aşağı ver. Okey. Aşağı ver. Yes, the Rumanero. Could you change this hub? Now you're a different company, and maybe you can do some improvement in this hub. Huh? Okay. It's a white neck aneurysm. It's need stenting, but it's also possible the P1 is patent, and that's why. Okay, we have two coils on the table. The first coil is 3/6 microplex. Okay. Balloon is in place, and now we can inflate it. We just need to stop the flow, to raise the flow, and I think it's enough. Huh? Отлично. Okay, it will a little bit protrude to the picon. It's not a problem. Yes, I think the coil is a little bit small. Huh? Oh, helical again. Like it's a helical. Екіде 6 оптима бере салшы. Aşağı veririz. Alıyorum. Берите. Yes, in such anatomy, it could be the flow from both sides. If you occlude the ICA, the flow may come from the PCA territory. That's why the full occlusion of the ICA is better to control the flow. Yes, the shape of the aneurysm is not so spherical, and but it's not the indication that the aneurysm 100% is risky, but two aneurysms, it's too much. Huh? Yes, it was 2/6. Бақыт әділі. Так, тағы да бір екі кетеді ме? Или бір жағынан екеуін салып жібереміз? Бір жағынан бере салшы тағы бір. Бір жағынан 4 болады. Я ошибаюсь. О, кірді? Да, был микроплекс. Был микроплекс. Даже all sodan ging. All sodan ging. Okay. Yes, this coil was microplex, 1.5 by 2. Okay. When you have different systems, it's a little bit confusing, huh? Все, давай. Okay, let's deflate the balloon first before the detachment. But I think the anatomy is friendly and we can renavigate. No problem. Okay. Now we can deflate the balloon. Deflation process will be slowly, yes? It looks like the coil masses start to protrude, huh? I hope it will stay at the Picom segment, okay. Yes, it's better to place the stent, but... Hazır. Nalık nalısır. Rabasın. Rabasın. Aç burası. Yes, the coil is stable. Yes. Yes, the coils in ACA Aneurysm is stable. The coil loop in ACA is not causing any problem. It's on the wall of the artery and it's okay. Patient on dual antiplatelet. We will remove the Brilinta and we'll leave the patient on aspirin. And aspirin for 1 month, I think it's enough. 1 week is enough, and because of these coils in the PCOM, it's also needed for some anti-disaggregation. I think it's okay. We'll take out this, and now we'll take out the wire from the PCOM. Oh, okay. Let's leave it there. There is slight bleeding, but it's mixed with contrast, and usually control CT on the next day, it's okay. And we'll ask the anesthesiology team to keep the patient on the low blood pressure, less than 100, for several hours, and then should be okay. Let's see the AP and water. Келесі пациенттің стенозға желдеді. Okay. The next case, patient with the intracranial stenosis, and then we have an AVM case. Yes, everything is clear. The brain is in place. Okay. I think we can take out the guiding. Now I will ask Abzal to do control CT, and after that we can take this next patient. Okay, I will wait for the control CT. Айналып тұра берсін. Айналып тұра берсін. Аромы звук можем пока выключить. КТ жасаймыз қазір. Давлениесін 100-ден асырмай, где-то 1-2 сағатты седация жасай тұрасыз ғой. Наркоз жалғастыру керек болады. Потом пробуем. Жоқ қылмай. Қазір КТ-сін бір көре салайық. Окей. Звук можно подключить, Рома? Okay. You can see the subarachnoid hemorrhage, which was expected. The fourth ventricle is clear. The cisterns is clear. Interpeduncular cisterns with contrast, and only the basal cisterns has some subarach, but it's not so much. I think patient will be okay. If it's needed, we can do CT in 2 hours, if it's needed. But I think it will be clear. Now the 30 minutes left after initial bleeding, and yes, the bleeding stopped, and we asked the anesthesiology team to keep the patient 2 hours in general anesthesia and then extubate. Okay, thank you. See you in 20 minutes. Intracranial stenosis next.